Okay, let's be real for a second. Getting that call, the one that says you have an abnormal test result, it's incredibly stressful. But when it comes to a pap smear, what does that word really mean? Well, that's what we're going to do today. We are going to break it all down, the screening, the results, the follow-up, and replace that anxiety with clear, empowering information. Let's dive in.
So, here's our game plan. We'll kick things off with the big picture on cervical health. Then we'll get into the nuts and bolts of the screening itself. From there, we're going to decode what an abnormal result actually signifies, lay out the follow-up plan so you know exactly what to expect, and wrap up with the most powerful part, how you can prevent this in the first place.
All right, first things first. I know this can sound like a really scary topic, but I want to frame this right from the start. The overwhelming story here is actually one of incredible success and prevention.
So why is this such a big deal? Well, to get why screening is so important, you have to look at the scale of it. Globally, cervical cancer is the fourth most common cancer in women. It's a major health issue, no doubt about it.
But here's the thing, and this is the most important part. Even though it's common, it is also one of the most preventable cancers out there. This is a solvable problem. We actually have the tools to stop it in its tracks, long before it ever becomes a serious issue.
And look, we have stone-cold proof that this works. This isn't just some theory. Just look at the United States. The number of cervical cancer cases has plummeted by over 50% in the last 40 years. And why? It's almost entirely because of widespread screening. It's an amazing public health success story.
So, how did we pull that off? What are these amazing tools that made such a huge difference? Let's take a closer look at the tests themselves.
All right, so let's get down to basics. What exactly is a pap smear? The first thing to know is that it's a screening test, not a diagnostic one. Its whole job is just to collect a few cells from the cervix so we can check them out under a microscope and look for any early precancerous changes. The whole point is to catch any funny business super early.
Okay, this is probably one of the biggest questions people have, right? Who needs to get screened and how often? Thankfully, the guidelines are really clear and based on a ton of solid research. If you look at the current guidelines from the CDC, it's actually pretty simple. It all breaks down by age. So you start screening at age 21. From 21 up to 29, the standard is a pap test every 3 years. Then, once you hit 30, all the way to 65, the best way to go is to get both a pap test and an HPV test together every 5 years. It's a really straightforward schedule. All right, so you did everything right. You went for your screening, you followed the guidelines, and then you get that phone call, the one that says your result was abnormal. This is the moment we really need to unpack, because it's where a lot of fear comes from. Okay, lean in, because if you take away only one thing from this whole explainer, I want it to be this. An abnormal pap smear is not, I repeat, not a cancer diagnosis. All it means is that some cells looked a little different, and we need to take a closer look. That's it.
So what are we talking about, really? The medical term for these cellular changes is cervical dysplasia. And here's the key. It's almost always linked to one thing, the human papillomavirus, HPV. Understanding that connection is crucial to understanding the whole picture. And this right here is why screening works so beautifully. Think of it this way. Cells don't just flip a switch from healthy to cancerous overnight. It's a slow, gradual process. They go through these intermediate stages, what doctors call low-grade and high-grade changes. Screening allows us to see this process happening in slow motion and intervene way before it's a problem.
And we can zoom in even closer. Doctors use a grading system called CIN. So CIN1, that's just mild changes, right at the surface level. CIN2 is a bit more, and CIN3 means the changes go through the full thickness of that surface layer. But get this, even CIN3, which is called severe dysplasia, is still considered a precancerous stage. We're still catching it ahead of time.
So your results basically fall into two main buckets. There's LSIL, or low-grade changes. These are super common, and honestly, most of the time, your own immune system clears the HPV infection and the cells go right back to normal. No treatment needed. Then there's HSIL, or high-grade changes. These carry a higher risk, so they're the ones doctors will keep a close eye on and treat.
And here's another piece of information that should really help you breathe easier. The reality is, most of us will be exposed to HPV at some point in our lives. But, and this is a big but, the vast majority of those infections are just temporary guests. Your immune system kicks them out within a year or two. It's only the rare, persistent infections that stick around for a long time that can cause problems.
Okay, but what if your result does need a follow-up?
what happens next? The good news is this isn't uncharted territory. There's a very clear, well-established roadmap.
It's basically a simple 4-step process. Step 1, you get the abnormal result. Step 2, your doctor does a colposcopy, which sounds scary, but it's really just a closer look at the cervix with a special magnifying glass. Step 3, if they see anything that needs a closer look, they'll take a tiny tissue sample, a biopsy. And step 4, based on that final biopsy result, you and your doctor make a plan.
And that plan is completely tailored to what they find. For those low-grade changes we talked about, the plan is often just watchful waiting. Come back in a year for another test to make sure things have cleared up. For high-grade changes, they'll usually do a simple procedure, like a LEAP, to remove those abnormal cells and prevent any future issues.
So we've talked a lot about finding these changes early, which is great. But what's even better? Preventing them from ever showing up in the first place. And this is where you have a ton of power.
So, how do you do that? How do you stop these cervical changes before they can even get started? What's the ultimate shield?
Hands down, the single most powerful tool we have is the HPV vaccine. It is incredibly effective at protecting you against the specific types of HPV that cause most cervical cancers. It's recommended for adolescents, both boys and girls, to give them protection long before they're ever exposed. It's a true game changer.
And beyond the vaccine, there are a few other really key things you can do. First, stay on schedule with your screenings. Consistency is everything. Practicing safe sex can also reduce your exposure. And finally, if you smoke, quitting is a huge one. Smoking actually makes it harder for your immune system to fight off an HPV infection.
So, when you put it all together, what's the big takeaway here? It's that through science and good habits, we have turned what was once a common danger into a largely preventable disease. It's about turning a possibility into a prevention. It's about knowing that you have the tools to be in control of your own health.